Hi, everybody. Thanks for joining us today. So we've covered a lot of really fun topics, and today we're going to cover one that I think is of high interest to pretty much everybody because the use of antibiotics is, widespread. And so today we're going to talk about how antibiotics impacts the gut microbiome and what that looks like in terms of when antibiotics is used and how often it's used. So antibiotics is one of the most widely used drugs in the world to treat a wide variety of bacterial infections. And I know for a very long time, and this has changed, but antibiotics was kind of if you're not sure, use antibiotics. And we have moved away from that. But it is still kind of hailed as one of the most kind of the biggest medical discovery in the 20th century was finding antibiotics. The downside is that its wide use has led to things like antibiotic resistant bacteria. And this is, both people carry this as well as we have these issues kind of in hospitals. And something that we're learning about antibiotics is that while antibiotics has its place and does a really good job, it does have unintended consequences. And what we'll focus on today is in the gut microbiome. And so we know that the gut microbiome can be impacted by antibiotics because antibiotics doesn't care if the bacteria is good or bad. It just wipes out bacteria. And so what's happening here is that we're disrupting the gut microbiome and can shift it into dysbiosis or dysfunction, as well as because we're not targeting good or bad bacteria, we're losing the good bacteria that we need in the gut. And this compromise can lead to sometimes an abundance of negative bacteria when things kind of grow back, or it can lead to altered diversity within the gut microbiome. And that can, in one way, defined as overgrowth in some bacteria that are negative. The other could be just a compromised level of diversity or composition after antibiotics.
Yeah, and I'm with you. I mean, antibiotics by far played the biggest role in us being able to live to the ripe old ages that we currently live to. And I think there's become a bit of an over-reliance, and I think a lot of fear from the prescribing physician standpoint if they don't prescribe when they should have prescribed. And so in these cases with medical, legal issues that come up, doctors are often over-prescribing. But I noticed, and this is probably like 10 years ago now, but a lot of a push from higher up, public health, to try to curb the overprescription of antibiotics. So yes, they're like the most critical aspect, along with hygiene and filtered water and a lot of other things. But antibiotics truly were transformational when they were first discovered, and I think we're switching over now to where if we continue to overuse and overprescribe them, the impacts are going to be detrimental, and they already are detrimental on our health and lifespan, to a point where if we don't curb them or think more strategically about how to use them and or come up with different forms of antibiotics that are much more precise, we're going to create a bigger problem than we had to begin with antibiotic resistance, which we know is a huge issue and is already killing, thousands of people every single year, but predicted to be much, much worse in the next 10, 20, 30 years if we don't really figure out how to solve this issue. And luckily, and we can get into this, a-FMT potentially has a role to play in this. So quite an exciting, past. The future is bright, but also there's potential for real risks, real harms, and real problems if we don't problem solve today.
Yeah. So we're going to focus in on the gut microbiome. The issues around antibiotics are larger than just the gut, but a lot of the issues may lie in the gut. And so I don't want to scare everybody because the gut microbiome is very resilient, okay? It has the ability to recover from antibiotic use. Having to use antibiotics on a very rare occasion does not mean that your gut microbiome is toast. That's my first preamble. I'm sure there will be more. But there is research showing that antibiotics change the gut microbiome and that there is the possibility of long-term consequences. This is most prevalent in early use of antibiotics. So in young children, using antibiotics is associated with increased risks of certain diseases, one of the big ones being asthma and Crohn's disease. There are a number of studies that have looked at the rate of use of antibiotics in childhood and later life changes and outcomes. And the other side is that while the gut microbiome has the capability to return to a good level of diversity, it is not always the same as it was before antibiotics. And this can take weeks or months to return. So there is a period of time where you may see shifts or changes because of that disruption of the antibiotics. And things can happen in that time that can also impact the ability of the gut to bounce back. Do you want to add anything in there?
Yeah, I mean, this is purely anecdotal, but when we were in the treatment phase of Novel Biome's activities, we were treating a lot of kids with autism. And as a part of that, I would speak to, and over several years, spoke to thousands of families, and I'd ask them about, the history that led to the diagnosis and where they were today, whether they were 3 years old, 5, 15, or 25. Just asking about the history. And in many, many cases, I'll reverse it. Only on two hands could I list the number of children that didn't have early use of antibiotics. Now, this isn't, saying that antibiotics are somehow causing autism. That's really not the case here. It just goes to show that early use of antibiotics has an impact on the gut microbiome. And we know the microbiome plays on almost every single system within the body, if not every single organ system within the body. And so I think there's really something to look at here as far as how can we potentially avoid or reduce the use of antibiotics and or be, again, more precise. I'm going to beat this drum, but really there are antibiotics or that exist and or that can be developed to be much more precise about what we're trying to target. My whole MO is really around precision medicine. And I think the combination of testing with interventions in a more precise way will change the course of the development of some of these conditions. And, we talked about this just before, but there was a study just recently published, and it was done in Sweden, and they looked at 15,000 adults. And we'll link to the study below. But they were looking at the use of antibiotics in less than 1 year and between 1 to 4 years and 4 to 8 years. And depending on the type of antibiotic, they're still seeing impacts on the gut microbiome and gut microbiome diversity up to 8 years later. And so in many cases, people are thinking, take an antibiotic and my system bounces back. And that is the case in a lot of respect. But some of these antibiotics, which are really hardcore, I'll say, can still have an impact on the gut microbiome and the diversity that we're seeing in the abundance of individual species across those different periods of times. And as Shana was pointing out, those impacts on diversity will then play a role in the potential development of some disease states, which we know are tied to imbalances in specific microbiome and bacteria within the gut microbiome. So very fascinating, and still, again, a lot to learn. But this is a long-term study looking at a lot of people, showing the role. And this is where, again, donor screening and understanding the donor's history with antibiotics is really critical. Even what types of antibiotics is a really critical component.
Yeah, and I think it's something that goes hand in hand, and we talk about this a lot, about we're more and more appreciative of the role of the gut microbiome. If we looked back 10 years ago, we were just starting to see that there was a conversation between the gut and the brain, but now we understand there's a conversation between the gut and pretty much everything. And so as we appreciate the role of the gut microbiome, we're seeing more and more the interactions with medications in the gut microbiome and the role that may play. And I think one of the big things about antibiotic use is that most people who have antibiotics, the risk gets higher with the repeated exposure to antibiotics. And so the likelihood that someone has more than one exposure to antibiotics in their life is quite high. In a lot of cases, sometimes this happens in short period. So you can have multiple uses of antibiotics over a couple of years. And so we know that antibiotic use has negative effects on the gut microbiome, and the gut microbiome does a pretty good job of trying to bounce back. The downside with this is the repeated exposure increases the likelihood that the gut microbiome can't or has a harder time of bouncing back. And so there's this really delicate balance of how the gut microbiome works and how it interacts with everything. And we do play a role in that through environment and diet. But as well, the types of medications we're using plays a role. And with repeated exposure, the length of time of the gut microbiome to bounce back can go into the months and years to fully recover. And these new studies, like you mentioned, that are coming out that are saying that it can be close to a decade and you're still seeing augmentation of the gut microbiome. One of the things that I've noted myself within the field is that people are trying now to offset the negative impacts of antibiotics while someone is taking them. And so this comes up in terms of being aware of your diet and being aware of other, shifts and really being kind of educated on, some GI discomfort and changes that may happen when taking antibiotics. Another thing that I'm noting both from the medical community and the non-medical community is the idea of using probiotics in conjunction with antibiotics to help offset this. This has its own issues because there are studies that show that using probiotics in conjunction with antibiotics can actually prolong the length it takes for the gut microbiome to return to normal after antibiotics. But I do appreciate that there is now this understanding that we need to account for the impacts of antibiotics on the gut microbiome. I just don't think we fully understand on a case by case, like as a whole, if you take this antibiotic, do this. We're not there yet, but I think we are getting to understand that there can be a lot of dysfunction caused by antibiotics, and we need to understand the impacts the gut can have on that.
Yeah, and this just reminds me actually of a study. Again, I think it was in Sweden, if not one of the Scandinavian countries. And it's not particular to antibiotics, but it's a similar role where children born via C-section, we understand that they're at an increased risk of developing certain diseases later in life. For example, obesity, type 2 diabetes. And so we know that they're at an increased risk. And that's because when born via C-section, you're not getting exposed to all of the microbiome that you would normally get when being birthed through the birth canal. And so what they did actually is they took the mother's stool. They tested the mother in advance to make sure they didn't have, any HIV and all these types of, infectious diseases, similar to as you would when screening a human a-FMT donor in the context of a microbiome stool bank, something like what we're doing at Novel Biome. But what they were doing then is they were taking a stool sample from the mother, they were giving it to the child as a part of their first feed, and they were then following up with them months later. And what they observed is that 6 months later, they had actually developed a microbiome, and that was with one treatment. They had developed a microbiome that was identical, or at least comparable, to the children that were born vaginally. So really an impactful study. And this is where my optimism with a-FMT is that, and you kind of pointed it out with the probiotics, but another opportunity is to either A, store the patient's microbiome as a part of what's called autologous a-FMT, or use an a-FMT donor to actually treat a patient immediately following antibiotic use. And I think, that's the beacon of hope that I would really shine light on and hope we could get to is either the patient storing their own microbiome prior to antibiotic use, or if that's not an option, or they didn't have that opportunity, or they've been using lots of antibiotics since, the patient could actually get a-FMT from a screened healthy donor to prevent any of these negative downstream effects that we know come following the use of antibiotics. And you're pointing it out, right? Like in a lot of these neurological diseases that we see out there, the presentation of GI symptoms precedes by a long time the actual development of these neurological conditions. And so in medicine today, we're really reactive, right? We're like, oh, well, someone's developing these symptoms, let's create a treatment that will minimize or remove the symptoms of that disease. But how could we be dealing with this at a much more fundamental level? And we say, okay, this patient is developing GI symptoms. Maybe they have a family medical history, or their genomics are indicating that they're at risk for development of a neurological disease. What can we do today to prevent that from happening? And it's hard to sell prevention, honestly, but I think that's really the future of medicine, is not being reactionary, not just trying to solve what current symptoms we're seeing today, but what are these symptoms an indication of, and what can we do today to help resolve some of them. And I know we've talked about this a lot. Of course, diet and physical activity and all the lifestyle things are really the key prevention. But what types of algorithms could we put in place so that when a patient presents to a healthcare provider and they have XYZ symptoms, we know they're going to be at an increased risk of developing certain conditions. So what can we do to solve that? And I think, again, resolving some of these microbiome disturbances much earlier will put us on a course to do just that.
Yeah, and I think there's something here about accounting for how the gut is playing in this whole big picture. And I think one of the things you hit on is this gut symptoms also often predate many conditions. And I think we're starting to appreciate the role of the gut in these larger scale conditions. I think it's, for a very long time, was hard for someone to think about something like Parkinson's or multiple sclerosis being somehow tied to the gut. But we're getting past that, because now, instead of just looking at what's happening right now, there are a lot of doctors that are looking back to say, is there any consistent patterns here that, well, for the current patient, we're past that point. We're at the, treating symptoms, but can we start looking back to see if are there things that are good indicators? Now, everyone that has that symptom may not end up with Parkinson's disease, but is it worth that? This seems to be in 80% of patients. Should we be treating that as a precursor with something like FMT to restore the gut microbiome in hopes that it helps prevent or reduce the likelihood of these kind of larger scale, very difficult to treat conditions? Things like Parkinson's and multiple sclerosis are very difficult to treat. We don't have a really good 100% treatment protocol that works all the time. Could we be treating it earlier and either reducing the likelihood or reducing the severity of the symptoms later in life? And I think that's one of the things that's so exciting about working in the field of fecal microbiota transplantation, is that the possibilities at this exact snapshot in time seem endless, because we're still learning what the importance of the gut microbiome is. We're still learning about how impressive altering it can lead to systematic changes. And we're in this space where a lot of what we know came accidentally. We know that the gut microbiome plays a role in Parkinson's treatment because people with Parkinson's had C. diff, got treated for their C. diff, and their Parkinson's got significantly better, which then led to clinical trials into further researching it. So it's such a cool time. Like, I get goosebumps, like literally get goosebumps talking about it, because it's such a fantastic time in medicine that we're appreciating that the body has the ability to heal itself. Now, that person's body may not, but by restoring the gut microbiome, we can restore other symptoms, understanding that biologics play a huge role, which is a huge shift in the concept of medicine. For a very long time, if you could not precisely target one thing and then replicate it over and over again exactly as it was never going to make it in medicine. It just couldn't, because the way that the standards were didn't allow for biologics. But we're getting there, we're seeing it, and we're seeing that change, and it's just mind-blowing and very exciting. And we have a ton of videos on FMT. We could literally talk all day about how cool FMT is. But I'll capture it here before we get into how this may play a role in terms of antibiotics and antibiotic-related dysfunction. But fecal microbiota transplantation, or FMT, is the idea of taking a well-screened donor who is healthy, who has clean blood and stool screening, has a good health history, has a good immediate family health history, capturing their gut microbiome from their stool purifying it so it's just down to what your gut microbiome requires to help engraft and repopulate, and then giving this to people whose gut microbiome has become dysfunctional, either in terms of the composition, the diversity, overgrowth, but being able to restore it. And so FMT has begun to be one of the promising approaches to restoring the gut microbiome after antibiotic use. And this comes in the form of many avenues, one of them being dysfunction caused by the gut microbiome not being able to bounce back. And this one great example that's well known in this is C. diff or C. difficile infections, which are basically a pathogenic overgrowth that leads to a lot of negative symptoms, including, in a lot of cases, unfortunately, death. And FMT has begun to be one of the treatments for this. And another avenue is in things like cancer treatment, where antibiotic use is needed, and augmentation of the immune system and things are needed. Using FMT in conjunction with treatment, before or after treatment, depending on what study you're reading, seems to really impact the ability of that treatment to be effective in reducing side effects for patients, which then makes them more likely to go all the way through with their treatment as well. And we use antibiotics not just to treat when someone is sick. It is used often in conjunction with other treatments. And FMT is being shown to maybe play a supportive role in this relationship. And I know this is something that you find also really cool, but also probably something you've thought about previously before this became something big in research, is, how modulating the gut during these periods is helpful.
Yes. It's funny. I'm just thinking, you were talking about the use of antibiotics alongside other procedures. And it reminds me of a time when my son broke his arm, and he was at the hospital, and there was no puncture, like the bone didn't come out, it just broke. And they needed to reset it and put a cast on and whatnot. And the doctor was saying, it's just a standard part of our protocol to give an antibiotic alongside the fixing of the arm, this sort of surgical, but non-surgical, right? They're resetting it. They're not actually cutting anything. There's nothing, invasive happening. And I said, really? Like, that's a standard part of your protocol? Well, I'm going to opt out of it. I just don't think that's necessary. And if he starts to develop, symptoms of infection or something else, like, absolutely, we'll come back. And if we need, we'll get the antibiotic. But I think it's, it takes real advocacy to try to avoid the use of antibiotics. Being a teenager who got a lot of them, the impact of it is significant. And when you're really ill and you're thinking like, man, I just got strep throat, let me get an antibiotic in, that's great. It will solve your problem very quickly if it is that problem, but it's ultimately potentially creating an even bigger issue. And as you pointed out, they sort of stack on top of each other. So random anecdote here, but I think it does really require each one of us to be individual advocates for ourselves personally, and then for our children or people that we know. Again, not minimizing the impact that antibiotics can have as being a life-saving mechanism to get you through something. But again, judicious use.
Yeah, and I think that's one of the things when I read about how great antibiotics are. One of the statements that is almost consistently used in all of those papers is that it's the most widely used drug. And I think in the cases of something like breaking your arm, or you go into the hospital, and I have a toddler, so the number of times it's like, maybe we should give her antibiotics. And I'm like, my follow-up question is always, and what's the goal of the antibiotics? Like, what do we think? Like, what are we seeing that leads us to think that? Because I think this is how we ended up here, Jason. I also had a lot of antibiotics as a kid, and I understand that a lot of the things that I deal with now as an adult are from that use. And I have severe allergies, and that's how I ended up needing antibiotics, not knowing about what it could be. But knowing that antibiotics seems to be a default that is changing. But I think anyone that has to take an antibiotic needs to realize that you need to be more aware of things you can do to support your gut health during that time period. And I think as we see a better understanding of what it looks like to have dysbiosis in the gut. I hope that with that, we start to understand the positive impacts we could be by restoring the gut microbiome as maybe a starting point versus always looking at it. I mean, in most of the things, it's third line at best treatment choice, where you're like, but what if we started there instead of ending there? If it's so effective, why are we ending at this as a possibility versus not starting earlier on? But I think the major part of the story is we all understand that antibiotics are an incredibly useful tool. They're extremely important in treating bacterial infections, but they can have unintended consequences. And I think it's important to always note that when you're going to use an antibiotic, especially something that's less targeted. That's just kind of like, let's knock everything out and hope for the best. I think being aware of its unintended consequences and what you can do to kind of maintain your gut health, and be aware that if that's not possible, being understanding or having conversations about what can I do to support my gut while this is happening. And while the gut microbiome is awesome and perfect and does everything amazing, it is important to understand that it can recover. And in the cases of using antibiotics sporadically, the gut microbiome has the ability, if not to fully recover, get to a point where we would not consider it being in a dysbiotic state. But repeated exposures to antibiotics make that more difficult for the gut microbiome to recover. And that we know that both antibiotic use early in life and later in life have been tied to the development of infections and conditions. As well, repeated use leading to dysbiosis puts you in that category of the role that we know the gut plays. So gut dysbiosis is tied to many health problems. So being aware of where your gut is, or if some of your symptoms could be tied to your gut, understanding how antibiotics plays a role in that, I think is huge. And both appreciating it and, as per everything, being somewhat hesitant about everything and asking more questions, I think is always the way to go. Both educating yourself or just asking questions when you're in a situation, just to better understand it. It may be that you have to take XYZ, but understanding what that can do and then seeing if you can offset it. Because, I mean, we're terribly biased and we'll talk about gut health all the time and the importance of it. But
I do think there's such a thing as like lazy medicine, right? Like, and partly it's driven again by the way that medicine is structured and the risks that doctors are unwilling to take. I mean, I was years ago, I bought a vehicle and it was from a medical doctor, and we were having this discussion about antibiotics, because even back then I was still very on team. We're overusing antibiotics, and he said, "Oh, I know all the time that the patient probably doesn't need it, but I prescribe it because if they get a more serious infection and I didn't prescribe them, I'll be in a lot of legal trouble. I'm just not willing to take the risk." And so we need to fix that part of medicine where doctors can actually make other suggestions, even using natural things that we know are not harmful, and or waiting a little longer, right? Like, we have an immune system for a reason. It's because it's designed to fight off these infections as they stand. And so if we could just wait 1, 2, 3 days and have the patient report back if things get worse, that would really make a big difference as well. But there's really, I think, a movement as far as even post-antibiotic use, as you pointed out, using probiotics, but the idea of rewilding the gut. And some of that would be, the diet, right? We've talked about this previously as well, just expanding the diet to include more diversity to support the rebuilding or rewilding of the gut. Eating and drinking fermented foods has a real impact. Getting out in nature and getting your hands dirty and hiking and exposing yourself to the microbiome that exists out in nature also plays a big role in rebuilding and rewilding the gut. And so, if you absolutely need to be on an antibiotic, then think about what types of strategies you could incorporate to help rebuild or rewild your gut to get back to that, a closer semblance of what diversity looked like. And another, thing that is somewhat of a theory, but I think is probably not a theory anymore, is the appendix and the role the appendix plays in sort of storing like a time capsule of what our microbiome looks like, and then injecting some of the contents of the microbiome that we need back into the microbiome when it becomes depleted, say following antibiotic use. However, again, medical interventions commonly are removing the appendix for good reason in many cases, right? Like if it's hurting, if it's bursting, it could kill you if you didn't get it out. But I think a lot of times it's just being removed as a cautionary, oh, it could be the appendix, let's just pull the appendix out. Same thing goes for the tonsils, let's just pull them out if they're getting infected. Like instead of being like, why are they getting infected? What can we be done to support the body to reduce the amount of infection that's happening? But in many cases, it's more convenient to pull it out than it is to start problem solving and figuring out why is this happening to begin with. But yeah, so I think that's something that we can really think about it as individuals, is like what can be done if we've had an antibiotic. Obviously, FMT would be a beautiful thing to do, but in many cases, that's just not accessible with the given regulations around the use of FMT. But I think that's the something to look at, is what can we do to rewild, rebuild through the use of diet, through the use of getting out in nature, through the use of prebiotics, probiotics, etc.
Yeah. As my mother always says, when you're not feeling well, go touch some grass. That's like one of her go-to statements. Like, go outside, touch some grass, be one. But it is part of the process is being, I think the number one thing you can do is be aware. And the number two thing you can do is what's something I can do today to better my health. And I'll always be an advocate for being aware of your diet. And can you augment your diet? Because it's the building blocks of everything else. And so I think kind of the moral of the story is kind of, like antibiotics are part of life. The number of people that are exposed to antibiotics, I think is probably, I don't want to say everybody, but it's very high. And so instead of going, and this is the end of the treatment, I think it needs to be, okay, and so then these are good things to do afterward to protect your gut or to rebuild your gut, knowing that antibiotics are like a hammer. You kind of have to go in and go, okay, so I've done this, I feel better, but let's make sure that I'm supporting my gut after, because we do know those things are definitely tied. But if you are super interested in FMT or the gut health, check out our YouTube channel. Listen to other episodes of the podcast if that's where you're gathering this information from right now. And then the other side is if you're a healthcare professional and you want to learn more about FMT and to better understand it, if you look in the description, you will see a link to our ebook, which just covers kind of the general information about FMT and how and what we know about it. And you can always reach out to us at Biome and ask us any questions you have in terms of healthcare providers and how this could play a role or your ability to access it. And thank you so much for joining us. So there will be more episodes. And I think next week, seeing we kind of brought up probiotics a couple of times here, I think we'll talk about probiotics, what we know about it, and how probiotics are not the same thing as FMT. So everyone can kind of get the difference and the beautiful difference that both of them play an important role. They both are great, but they are nothing alike. And thanks so much for joining us.
See you on the next one.